Am I audible to everybody? Is my audio clear to everyone?
Sir, you are audible, but your volume is very low.
Okay, let me try raise my volume. Okay, I hope it is clearly audible to everybody now because I have tried. Okay, so let me just brief you about our today's expert, Dr. Vrunda Kapadia. She is a physiotherapist and Master of Science in Rehabilitation Sciences. Is a licensed physical therapist currently working in the United States in a hospital setup. She earned her bachelor's degree in Mumbai and her master's degree in Rehabilitation Sciences from University of Pittsburgh, USA. Her areas of practice include vestibular and orthopedic rehabilitation. Her experience spans across various types of clinical settings. Vrunda's work for advancement of the physical therapy profession includes her role as a Chief Operating Officer of a 501(c)(3) non-profit organization for an academic credentialing tools and service that serves to assist internationally educated physical therapists with the licensing process in the United States. She has been a speaker at multiple webinars for internationally educated physical therapists about the physical therapy education opportunity in the USA and on the licensing process for internationally educated therapists. So I heartily welcome our today's speaker, Dr. Vrunda Kapadia, on behalf of Rajchandra College of Physiotherapy. Now I'm handing over today's session to our speaker, Dr. Vrunda.
Thank you, Bhavik. Can everybody hear me? Perfect. Thank you so much. પોતે ગુજરાતી થઈને મારી માટે ગુજરાતની યુનિવર્સિટી માટે પ્રેઝન્ટ કરવાનો બહુ જ ખુશીની વાત છે. સો આઈ એમ વેરી ગ્રેટફુલ ટુ ભાવિક અને શ્રી રામચંદ્ર કોલેજ ઓફ ફિઝિયોથેરાપી કે મને આ અવસર આપ્યો. And thanks to all of you for attending the webinar today. I think the fact that all of you are here, like Bhavik mentioned, tells me that you guys are serious about pursuing your further education or exploring all the opportunities related to this amazing profession, whether it's in your own country or whether it's abroad. So I'm really glad to be here today, and I'm happy to answer any questions at the end of the session.
Dr. Vrunda.
Yeah. Bhavik, were you trying to say something? Okay, I'm just going to go ahead and share my screen.
Hello, Derek. If you can unmute yourself and kindly give response to me. Hello, Dr. Vrunda, are you there?
Yeah, I'm here. Can you hear me?
Okay. Yes. Thank you, Dr. Vrunda. You can. Yes. No. No, Dr. Vrunda, we cannot hear you.
Can you hear me now?
Okay. Yes. Yes, Dr. Vrunda, we can hear you. You can proceed further with the session.
Okay, perfect. Thank you, Bhavik. And if at any point in time, if we lose connection or if you can't hear me, just feel free to let me know in chat and I can repeat what I've said. Okay. Bhavik, I'm going to.
Yes, Dr. Vrunda, before we start the session, I would request all the participants that if you have any doubt, even before the session, okay, you just note it down, and even during the session, you come across any query, just note it down so that at the end of the session, those queries can be solved. And I hope Dr. Vrunda will willingly do that. Am I right, Dr. Vrunda?
Absolutely, absolutely. That would be my pleasure. And we also have Derek Camilleri with us today. Derek is actually the CEO of our nonprofit organization, and he has graciously volunteered to spend his time with us this morning. And if you have any questions, he will be happy to answer those in chat. And I will also be taking questions at the end of the session. So I think we should be good there.
Yes. Oh, once, and I would also like to invite Derek as well, CEO of FACTSPT. So, very warm welcome to Mr. Derek, and we are happy to have you on today's session. So, over to you, Dr. Vrunda.
Thank you so much. Okay, I'm going to go ahead and share my screen. Okay, can everybody see this?
Yes.
Also, I just realized Google doesn't allow me to have the chat box open when I'm presenting, as far as I know. So we're going to hold off on all the questions for now. And at the end, we'll just go through the chat and answer the questions that haven't been answered. Okay. So,
Dr. Vrunda, I will note down those queries, and I will ask those individuals who have asked their queries. They will personally discuss the query with you.
perfect.
Okay.
Perfect.
Thank you.
Thank you. Okay, so welcome everybody to this webinar. We are going to be talking about physiotherapy licensing, education, as well as career opportunities in the United States. Um, just like you, even I always dreamt of going to the US and having a career, making a career for myself over here. And my journey started about 4 years ago. I graduated with a bachelor's degree in physiotherapy from Maharashtra University of Health Sciences, India. And then I came to the US. I pursued my master's in rehabilitation sciences with a specialization in neuromuscular physical therapy from University of Pittsburgh. I'm currently pursuing my doctorate in physical therapy degree. I also work as a full-time outpatient physical therapist in an OPD setting with a huge hospital system over here. Along with this, I volunteer my time for a nonprofit organization called Facts for Physical Therapists. Like all of us know, the process of moving to a new country and taking the license exam, becoming eligible to be a physiotherapist, taking courses and everything is a very tedious process. And that's the very reason why Facts was created. Like all of us at Facts have been through the journey that you will potentially go through one day. And we're happy to help you at every step of the way. So if you have any questions, let us know. And to be a licensed physical therapist in the US, you have to take a license exam. And we'll be talking a little bit about that today. And there are a lot of tutoring options available for that. And I currently work as a content creator as well as tutor for NPTE Final Frontier, which helps especially internationally educated physical therapists with preparation for the license exam and clearing the license exam in the US. Okay, the main topics that we'll be talking about today are opportunities for further education in the US, and we'll mainly focus on pursuing a master's versus doing a TDPT. The second thing we'll be talking about is steps for becoming eligible to take the license exam. This is for students who plan to stay in the US and work in the US as a licensed PT after completing their education. We'll also talk a little bit about how to prepare for your license exam, which is the NPTE. And then we'll talk a little bit about career options for physical therapists in the US. And depending on how much time we have, we will also be taking live questions. So let's get started. In the US, there are like for a foreign trained physical therapist, right, who's coming to the US, there are multiple options that you can pursue, right? And this can be really, really overwhelming because you don't know which one's going to be the best for you. What my recommendation would be is start with the end goal in mind. Okay, so say for example, if your goal is to come to the US and become a professor, then pursuing a PhD would be a better option, right? Or if your goal is just to come to the US and practice just like you do in India, then you can either pursue a master's or a TDPT and then take your license exam and start working accordingly. For people who are interested in further enhancing their clinical skills, you can pursue a residency. I'm right over here. So you can pursue a residency or fellowship option as well. The thing about the residency and the fellowship program is that you have to be a licensed physical therapist already before you can pursue one of these. So your master's program, your options for master's program in the US, so you can do a master's in rehabilitation sciences. That is something that I did. You could do a master's in kinesiology or exercise physiology as well. These courses are anywhere about for about 1 to 2 years long. Okay, the second option, which is what a lot of students pursue these days, is doing a transitional DPT, which is also known as your post-professional DPT. I'm also pursuing this right now. So there are 3 ways you can pursue this. One is doing it 100% online. The other one is doing it 100% on site, on campus. And then you also have some schools that offer hybrid options where 50% of it is online and 50% of it is on site. So depending on what fits your needs the best, you can go ahead and look for universities accordingly. Like I mentioned, if your aim is to become a researcher or become a professor at a university over here, you will most likely be required to have a PhD, which could be anywhere about 4 to 5 years long. Again, in the US, you have online, on-site, as well as hybrid options. We already spoke about the residency program. Think of residency program as more of a specialization, just like we have, like how in India we have masters in cardiopulmonary physiotherapy or masters in neuromuscular physiotherapy. So similarly, so in the US, you don't have masters in cardiorespiratory physiotherapy or masters in anything. And most of the transitional DPT programs will also not give you a specialization. They're pretty generic, like your BPT degree, right? Your BPT degree is not a specialization in one particular area of practice, right? So if that is something that you would like to pursue, then you could pursue a residency or fellowship. There are different options. You can do a residency in oncology, in neuro, in pelvic health, or which is also known as your women's health physiotherapy. You could do it in orthopedics, sports, whatever you like to do, you can pursue that. And for those of you who are not interested in being a clinician, but you still want to do something with the healthcare profession, you can always consider pursuing an MBA in healthcare or an MPH or an MHA degree. MPH is your master's in public health and MHA is your master's in health administration. Okay. Another super important thing to consider is the money aspect of it, right? First is obviously how long is the course. You know, your PhD is going to be anywhere between 4 to 5 years versus your master's or a TDPT, which is your transitional DPT, is going to be about anywhere between 1 to 2 years long, right? And all of your online courses are going to be relatively more inexpensive as compared to your on-site courses, right? Because when you're doing any course on campus, you have to pay for your residence, you have to pay for your food, all the courses are going to be more expensive, your travel expenses, all of that. So whenever you're trying to decide what you want to pursue, like whether you should do online, whether you should do on-site, whether you should do masters or a transitional DPT, consider the finances as well. And that way, considering the time as well as the money is going to be a smart way to go about with it. Okay, some of the major questions that a lot of students that I work with always have in mind is, should I pursue a doctorate in physical therapy or should I pursue a master's degree? Is it going to be compulsory to have a DPT degree to practice in the US or not? So these are some of the most commonly asked questions. And I think here is a very good overview of some of the things you should be aware of, right? So in your on the left-hand side, we are talking about your TDPT, which is your transitional DPT. That it basically helps you major in physical therapy, which is a very general thing, versus when you're doing your master's, you could do your master's in kinesiology or exercise physiology or rehabilitation sciences, just like I did. Having said that, again, none of these courses go into a lot of specifics about, okay, let's focus only on cardiorespiratory physiotherapy, or let's focus only on neurophysiotherapy. These are very general courses. You'll be studying a little bit about each and everything, just like you did in your bachelor's, right? the TDPT programs are, because it's a doctorate in physical therapy, they're going to be more clinical in nature. Okay, so if you are looking to enhance your clinical skills, think as a physiotherapist. I would recommend doing a TDPT over a master's degree. Okay, so your TDPT programs are more clinical in nature. If you do an on-site program, you're going to get a lot of hands-on practice, whether it's manipulations and mobilizations, whether it's doing your vestibular rehab, you can practice on one another. So that's an advantage of doing an on-site TDPT. Versus if you're pursuing a master's degree here in the US, unlike in India, right? In India, even if you're a master's student, you're going out and you're working with patients all the time. In the US, as whether even if you're pursuing a TDPT or master's, you don't really get to work with patients directly just because the rules are very different over here. But at least in the TDPT program, you can practice all the practicals on each other because they will be teaching you all of that. Most of the master's program, like if you do a master's in kinesiology or exercise physiology, you're not going to get even that experience. They're not going to teach you how to do manipulations and mobilizations and all those things, and you're not going to get to practice it with one another. So that is one of the disadvantages of pursuing a master's degree. However, the most important, so this is where you might probably be wondering that if you're not really learning more clinical stuff, and if the master's program is more research focused, why do students do it, right? So it's because of the third point over here. Most of the STEM programs, STEM stands for science, technology, engineering, and math. So most of your master's program falls under the STEM category, which means that once you graduate, you will get anywhere, depending on which program you choose, you will get anywhere between 1 to 3 years of OPT. Now, OPT means optional practical training. Okay, which means, for example, just like all of you know, to work in the US, you need an H-1B visa, which is your work visa, right? So, and it's kind of difficult to get a work visa, right? Because it's so competitive and there are so many applicants. So if you pursue a master's degree, you get something known as OPT, which will be valid for anywhere between 1 to 3 years, which means that after graduating, you can take your license exam and you can work in the US for up to 3 years without having a work visa, which is your H-1B. So even if you don't have your H-1B, you can still work in the US for 3 years with a master's degree. With the TDPT, which is your transitional DPT, you get a 1 year OPT only. So after 1 year, after you graduate, you can work only for 1 year before you will be required to have an H-1B. If you get the H-1B, great, you can stay here, you can continue working. But if your H-1B doesn't get picked, then either you'll have to go on a student visa again and pursue some other course and then get OPT again, or you will have to go back to your own country. So that's the advantage of doing a master's program, is though it's not too clinical, you do get up to 3 years of OPT, which is a great opportunity to work, and you can gain clinical experience while working with patients. And that's the advantage of doing a master's degree. And your TDPT programs, which is your transitional doctorate in physical therapy, they kind of help you prepare well for your national physical therapy exam, which is your NPTE, which is the license exam that you have to take before you can practice. So your TDPT programs are pretty much geared towards the syllabus that is similar to the NPTE exam, versus if you're doing a master's or a master's in kinesiology or exercise physiology, then you're not going to study, like I mentioned, it's not very, very hands-on or not very clinically oriented. So in that case, there are going to be fewer topics that are relevant to NPTE. And that doesn't mean that you cannot do it. You can absolutely go ahead and do it. And like I mentioned, there are a lot of courses and tutoring options available for foreign trained physiotherapists to prepare for their license exam anyway. So for students who are very confident of their skills already, and the goal is eventually to work in the US long term, and you are okay with not gaining any further clinical education, I think masters would certainly be a good option, because you're going to get this 1 to 3 years of OPT extension. But for new graduates who are still kind of unsure about their skills and are still trying to figure out, I'd say either gain work experience and then come to the US, or consider pursuing a TDPT over a master's And so that way you can learn a little bit more when you're doing the program on site, and then you can apply for the 1 year OPT and then H1B. Having said that, even an experienced clinician can absolutely do TDPT, and even a new graduate can absolutely even pursue a master's degree. But this is just based on my experience of having pursued a master's as well as a TDPT, as to which one would be better in which case. Okay. Like I mentioned, the US gives you a lot of options online versus on site TDPT programs. And I've read a lot on social media platforms that there are a lot of schools that really push you to pursue an online TDPT from India. And that's definitely not a bad thing. It's certainly, like I mentioned, online programs are relatively more inexpensive. So if you pursue your TDPT from India, that's okay. You're still going to learn the same things that you would have learned in the US. The disadvantage is that if you do a 100% online TDPT, you're getting no hands-on training because it's completely virtual. And we are physiotherapists, right? In US, physiotherapists are called physical therapists. So it's a lot of physical work, a lot of hands-on things that we do and that we should learn when we are pursuing any further education in this profession. So I think that's the disadvantage of doing a completely online degree versus if you're doing an on-site or a hybrid program. Yes, it's going to be relatively more expensive, but the return on this investment is going to be that you're going to potentially be a better clinician because you will have had that hands-on practice, whether it's on your classmates or your professors or patients, whatever that is. Okay. The other disadvantage of doing an online TDPT is that, and this is what a lot of programs that advertise will not tell you. And as a student, I feel like if I am deciding whether I want to pursue my higher education in the US or not, this is something that I would want to know is that are you going to get a visa after that or not? So your F1 visa is a student visa. So if you're doing the course 100% online, right, from India or and wherever you're joining from today, you don't need an F1 visa. You don't need a student visa because you're not entering the country, right? Versus if you are doing an on-site program, you will get an F1 visa, which is a student visa. You will be required to have it, which can then give you the option of pursuing the OPT or the CPT for at least a year, right? So what I'm trying to say is if you do the course in the US, like if you actually come to the US and study, you will have this opportunity to work in the US for at least anywhere between 1 to 3 years without an H1B visa and kind of make up for the money that you have spent for the program. Versus if you do an online program, right, you are not getting this OPT, which is being able to work in the US without a work visa. You're not going to get the OPT. So there have been students who've done the course completely online because they were not aware about this. And then to come to the US, you directly have to have an H1B visa. And it's kind of difficult to get an H1B visa that way. So just be aware of that, the online option. So if your goal is just to study and not work in the US, like maybe you just want to be aware of what is being taught in a different country, and you are not really that much concerned about coming and practicing in the US, online TDPT is a fantastic option. But if you want to come to the US and work over here, whether it's short term or long term, it's preferable that you pursue an on-site or a hybrid program that just basically improves your chances of at least being able to work for 1 year minimum, and maximum we don't know. So and like I mentioned, the on-site one is going to be more expensive. The online one is going to be relatively more inexpensive. So I hope that clarifies some of the questions that you had. As a student, like whenever you apply to the US, there are a lot of things that you have to do. You have to take, being a foreign trained physiotherapist, you have to take your TOEFL exam, which is your test of English as foreign language. Each school has its own cutoff score. So there are 4 sections. You have speaking, reading, writing, and listening. So there are 4 sections, and you can study for it and take the exam in India itself. You don't have to come to the US to take it. There are a lot of schools that will accept IELTS, which is IELTS, your International English Language Testing System. I have personally not taken IELTS, but I've heard from some of the students that I work with that it's easier than TOEFL. The only thing is IELTS is not accepted by all the schools, number one. And secondly, for your H-1B visa, they require you to have taken TOEFL and not IELTS. So if you have the option, go for TOEFL so that you don't have to take another English exam again later on. Okay. The second thing is a lot of schools, especially if you're applying for an MBA or MHA or something, you will be required to take your GRE exam, which is your graduate record examinations. All of us know there are a lot of, if you're concerned about the score and everything, there are a lot of coaching programs in India that train you to take this exam as well. So I would encourage you to explore that in your own area. Next is you will be required to send transcripts as well as your mark sheets from your bachelor's or master's program. You will also be required to do an academic credential evaluation. Okay, so you can depend, again, check with the school that you're applying to. Some schools require you to go through WES, some schools require you to go through ICD. So check with the school that you're applying to, and basically this is a super easy process. You just see which evaluation the school that you want to apply to, just see which evaluation they want, and you can go to this particular website. You can send your documents to them. They will do the evaluation and they will send it to you as well as send it to the university. And that should be it. Like, you don't have to do, all you have to do is send your documents and tell them which university you're applying to, and they will do the rest. Okay. Another super important thing is your letters of recommendations. Extremely important. Most schools require anywhere between 2 to 3 letters of recommendation, and you could have letters of recommendation is basically getting a recommendation from either your professor or your supervisor or your employer, telling the university why your employer thinks or why your professor thinks you would be a good fit and why you should be accepted to the program. So make sure you're aware of this. Sometimes this can take a while, so make sure start, if you want to come to the US, start talking to your professors about it and let them know that you will be requiring a letter of recommendation from them, so everything gets done on time, right? And the last and the most important thing is your statement of purpose. Statement of purpose, again, think of it as an essay that you have to write. So to the university that you're applying to, describing why do you think that you're a good fit, why should the university accept you, or what are your goals, like why are you pursuing this particular program. When they are selecting students, they really want to make sure that they kind of accept students who are really interested in studying. So just make sure you do a good job writing your statement of purpose, and it's super easy. All you have to do is write about why you want to apply to this school, which particular course you're interested in, and how do you think this particular course is going to help you in your career as a physical therapist. Okay. Coming to the second part, say once you're done with all of this process, you applied to the school, you got accepted, and you're now currently pursuing either your master's, PhD, TDPT, whatever. After that, you have to think about your license exam, right? Most of the students kind of wait till they graduate and then they start with the licensing process. I would strongly recommend that if your course is 1 year long, start with your licensing process like as soon as you get here. If your course is about 2 years long, then at least by the end of the first year, start applying, because this can also take some time. There are a lot of factors over here which can influence how long it's going to take for you to become eligible for taking the license exam. So I would just recommend at least give it 6 to 8 months minimum to gain this eligibility. Okay, so the first thing you need to do is select a state that you want to get licensed in. So say you're pursuing your TDPT in California, but you want to practice in New York. That's okay. You can apply to New York in spite of living in California. So select your state. That's going to be the first step. The second thing is going to be starting with your credential evaluation. Okay. Now this credential evaluation is different from the academic credential evaluation. Okay. So this was academic credential evaluation done by these agencies for your licensing process, you have to do a second credential evaluation, which is done by various organizations. There's one known as SRCP, there's CGFNS, there's ICD. There are a lot of organizations that do a credential evaluation. So the process remains the same. Again, you will have to ask your university to send your transcripts, your documents, your mark sheet, your internship completion certificate. All of that your university will have to send to this credentialing agency. Okay. Once this credentialing agency receives all the documents, they are going to compare your education with the education standards in the US. Okay. And they're going to say, okay, the students in the US study these 20 topics, but in India, you have studied only, in your university has taught you only these 15 topics, and you're missing these 5 topics. So if you have these lacking, if you have these deficits, you will be required to fulfill these education credits. So they will say that, okay, you did not do a course on system interaction, or you have not studied so much about pelvic health. So then they're going to ask you to do these courses, and you can do them you can do these courses online from US based universities. And once you do these courses, you do the credential evaluation again. And once that report says that, okay, your education is equivalent to the education in the US, then you are eligible to take your license exam. So a lot of times students just luck out. Like, so some of the universities are really good, and their physiotherapy syllabus is very, very, very comprehensive, and they don't really have any deficits. And within one go, they get their credential evaluation done, and they're eligible for the license exam. But most of the Indian students that I've worked with, they do have at least anywhere between 3 to 10 deficits, depending on which school you come from and what your syllabus looks like. So once you know that, okay, these are the courses that are lacking, you have to figure out where to do those courses from, and then you have to apply for a reevaluation, and then you can take the license exam. Okay. And don't stress about, oh, how am I going to figure out where can I do this school from, which university in the US, and which university in the US is going to offer the course or anything. And that's actually one of the reasons why FACTS was created. When I was a student, I had about 7 to 8 deficits, and I was completely lost where to do the courses from. And I wish I had FACTS back then. But we at FACTS, all of us, like I mentioned, have been through the same process. So this is something that we can help you with. Like, say you have 20 deficits, 20 courses need to be taken. So we can help you figure out, okay, you can take this course from this university, or maybe some other university is cheaper than the first one. So we can tell you, okay, you can go ahead and do the course from the second university. That will help you save some money. So we definitely help with all of those things. So don't stress about this, but just be aware that in spite of doing a TDPT or a master's, you might be required to take some additional courses, which are going to be different from your TDPT and master's. You might be required to take some additional courses just to be eligible for licensure. Okay. If your goal is to come to the US, study, and then go back home, then you don't have to worry about any of this. This is specifically for people who want to stay in the US and take their license exam and work over here. Okay. Once your credentialing agency tells you that, okay, your education is equivalent to the US standards, then you can go ahead and register with the state. Remember, we spoke about selecting a state. So then you can go ahead and register with the state board and then the process is different for all the 50 states. Depending on which state you're applying to, you can fulfill the state's requirement. Okay. Some of the documents that you will need when you're registering with the state for your license exam is going to be, obviously, you have to fill the application form that you can find on their website. You will be, like I mentioned, you will be required to send a TOEFL score. There are certain states that will say, okay, you don't need to take TOEFL, it's okay. But there are, most of the states will require you to take a TOEFL score because you're an internationally educated physiotherapist. So make sure you have those scores ready. Some states require you to have a social security number. Don't worry about it right now. Most of the states don't require you to have it, so I'm not going to go into details of that. There is something known as jurisprudence exam that you may be required to take, depending on which state you apply to. And jurisprudence exam is very easy. What it is basically how in India, if you're a physiotherapist in Gujarat, right, you can directly go to Maharashtra and work, or you can go to Bengal and work, and you don't have to worry about anything. But in the US, it's very different. Okay, each state has its own rules. So say one, like for example, North Carolina is going to say, okay, physiotherapists can do dry needling. But another state is going to say, no, physiotherapists in this state cannot do dry needling. You have to be an acupuncture specialist to do any sort of needling. So every state has different rules. So what this jurisprudence exam does is, what the jurisprudence exam does is you basically have to read the state's rules that, okay, if I'm practicing in New York, am I allowed to do dry needling? If I'm practicing in New York, am I allowed to do spinal mobilization? So each state has its different rules, and jurisprudence exam is just to make sure you're aware of the rules in your state. I wouldn't stress too much about it. This is later on in the process, but just be aware that there are certain states that require you to take a jurisprudence exam. Not all states require you to take it. So again, select your state accordingly when you're considering, okay, should I work in New York or should I work in California? California has an exam. New York doesn't have an exam. So that's another thing that you can consider when you're deciding which state you want to live in. Okay, you will have to submit your evaluation report also to the state board, and some state boards require you to do a criminal background check. All of this information is available on this, whichever state you're applying to. It's available on their website. So if you want to read up more about it, you can do that. Next most important step, after this step, you're going to be eligible to take the license exam. So this is where we talk about the license exam itself. Okay, the license exam is called NPTE, which is your National Physical Therapy Examination. Okay, this is the best thing about the exam. It's a 250 question. All the questions are multiple choice questions. So I'm sure this makes a lot of you happy. I'm sure I was really happy that I didn't have to write 2-page long answers on what is the management for stroke or all of those things. So you don't have to write an essay type question. You don't have to write a long essay type answer. It's just pick the correct answer out of the multiple choice. You get about 5 hours to answer these 250 questions. Okay. And your passing score is a 600 on 800. So out of these 250 questions, 50 questions are going to be eliminated. So they're not going to count. And we don't know which questions are going to be eliminated. So basically they count your score out of 200, and technically each question is for 4 points, which makes it a 800 mark exam, and 600 is your passing score. Okay. If you look at the stats over here, this is from the FSBPT website. Your first time candidates, like the people who are taking the license exam for the first time and who are graduates of a non-US program, that means all of us, right? All of us foreign trained physiotherapists, look at their passing rate. It was only 34%. So as much as you might think that, okay, it's only multiple choice, it's going to be fine, you have to study for it. Don't take the exam lightly, because there are a lot of new things that you will learn when you prepare for this exam. So make sure you're committed to this exam. Here I've added the blueprint of the exam if you're wondering about what are some of the things that you should focus on, right? So if you look over here, the whole exam is divided into different systems: your cardiopulmonary system, your musculoskeletal system, your neuromuscular system, integumentary system, so on and so forth. Your majority of the questions in the exam are going to be from MSK, right? And then the second highest weightage is neuromuscular system. So make sure your musculoskeletal and your neuro concepts are thorough. And third in line is your cardio-respi, which is great because for all of us in India, we basically have 3 major areas of specialization, right? MSK, neuro, cardio. So even if you've done your specialization in either one, or even if you're a bachelor student, and these are some of I think the Indian syllabus kind of focuses a lot on these 3 areas. So you should be happy about it and definitely focus on these 3 areas. But having said that, you have to be aware of the integumentary system as well. Integumentary system has mainly to do with your wound management and your skin care, right? Patients can have pressure ulcers, especially patients who have spinal cord injury or stroke, or who are bedridden and you cannot move. So they have skin issues. So as a PT, as a physiotherapist, you should be aware of all of those things. Metabolic and endocrine disorder basically talks about your thyroid and your diabetes. And as a physiotherapist, if you're treating a patient with diabetes, what should you be aware of? How can you be a safe physiotherapist, right? You want to make sure that your patient is safe too. So how can you be a good clinician and make sure that your patient is safe when he or she is exercising with you. Your gastrointestinal system, your genitourinary system, lymphatic and system interaction are some of the other areas that you should be focusing on. Okay. And in addition to that, this over here, which is your equipment, devices, and technology, and your therapeutic modalities, basically, is nothing but electrotherapy. Electrotherapy, is that what it's called in India? Yes, it's your electrotherapy. So all of these topics fall under the electrotherapy category. Next is your safety and protection. Just knowing when to treat a patient, when not to treat a patient, right? If a patient's blood pressure is 230 by 110, you should know that this is not a good time to treat the patient. Like, you need to send the patient, you should encourage the patient to seek medical help immediately because the patient's blood pressure is too high. So just being safe when you're working in the clinic. Professional responsibilities. This basically talks a little bit about your ethics as a physiotherapist, how you should be following all the rules and regulations, how you should be thorough with your documentation and all of that stuff. And the last is your research and evidence-based practice, which of course all of you are aware of. Okay, so considering that there is so much stuff over here, and I feel like we all are great as foreign trained physiotherapists, we all are great over here, but there are certain systems that we don't focus too much on, right? So what do you do about it, correct? When I was a student and when I saw the blueprint and I was trying to figure out how am I going to go about with this? How do I know which topics are important, which topics are not important? I started doing my research and I started Googling stuff, right? So you have to prepare your NPTE the smart way. So I started Googling all the stuff, and on the American Physical Therapy Association, which is your Indian Association of Physiotherapy counterpart, right? American Physical Therapy Association. I was looking at the American Physical Therapy Association website, and I found out about NPT Final Frontier. And this is a 100% online 11-week program that I signed up for, and I think they did a very good job of training me and helping me prepare for my license exam, and I could knock on wood clear it in the first attempt, and I didn't have to keep on taking the exam multiple times. So I would encourage you to look into what options are available when it comes to preparing for your license exam, unless you're confident about preparing it. I mean, studying for it yourself, that is also absolutely okay. So once you clear your license exam, great job, you've actually crossed the biggest hurdle. Okay, and now's where your life begins, right? You're done with your education, you're done with your license exam, now you're licensed physiotherapist in the US, and you can start working, you can start looking for jobs. So this is, again, I think this is from the Bureau of Labor Statistics website, and this kind of gives you an average about what are the expectations, what's the expected salary range, or if you've done a specialization, how much can you expect, right? So for example, we're going to focus on this, basically your PT salaries. If you look over here, majority of the patients, majority of the physiotherapists, which is about anywhere between about 1/4 of the physiotherapists, which is 25%, fall into this category. So as a physiotherapist, you could be making anywhere between $75,000 to $85,000. Having said this, this is a very generic overview, right? This can vary depending on which state you're working in, or if you're specialized in one particular area, like say neuro or pelvic health, you can expect a little bit more or a little bit less depending on your area of specialty. But on an average, this is what most of the people get. If you look at this, the next highest is anywhere between 65 to 75,000. So again, that's the range you should keep in mind. So whenever you're going for interviews, or if somebody asks you how much would you expect, I think this is a great way to figure out to plan things ahead, right? Figure out how much you should be expecting, so on and so forth. Okay. Like you can see over here, I really like this because this kind of talks about what specialties are available in the US. You could be a geriatric physical therapist. You could specialize just in pediatrics without having to do adult neuro, right? You could do neurology, which is your adult neuro. I know in India, I think most of the schools, especially my school, we kind of clubbed peds and neuro together. So you have to do adult as well as pediatric neuro. But in US, they split it. If you're a neuro PT, you kind of focus a little bit more on adult neuro. If you're a pediatric PT, you focus on that more. Next is your sports medicine or orthopedics. You have aquatic therapists over here, which is upcoming and which is very new. A lot of people are kind of exploring that. Hand therapy is another thing. Cardiovascular you already know, and women's health specialty. And like you can see over here, actually majority of the physiotherapists don't, even in the US, don't really have a specialization, and that's okay too. You don't have to, if you like doing neuro, orthopeds, everything excuse me, you don't have to specialize in any one thing. You could do all everything. um, some of the things to be aware of after you have taken your license exam, and once you're licensed, is to say, for example, you took your license exam for New York, but you got this amazing job opportunity in California. And if you want to move to California, you will have to endorse your license, which is a different process. And I'm not going to go into details of that. Um, but if you do have any questions, you can reach out to me later on. And obviously, once you're here, you can figure it out for yourself as well, right? There are a lot of options for PTA and PTA job search. Your LinkedIn or your monster.com, all of those are great options. So use technology, use the internet that you have, and start looking for jobs ahead of time. Don't wait till you graduate, or don't wait till the last minute. At least know whether you want to work in inpatient facility, like, or do you want to work in outpatient, so on and so forth, and look for jobs accordingly. Do a good job on your resume and cover letter building and your interview skills. If you look at some of the websites that I've mentioned over here, like your nptfinalfrontier.com, they do have something known as Life After NPTE, and that can help you with everything, starting from how to endorse your license, how to look for a job, resume writing, interview skills, so on and so forth. And if you are just getting started, and if you have any questions about how do you become eligible for the license exam, or if you have any questions for me and if you want to reach out to me, you can send me a message at contact@factspt.org. And we have a huge team of internationally educated physiotherapists from around the world, and we're more than happy to help you with any questions that you may have. Like I mentioned, it's a non-profit organization, so as compared to a lot of other agencies, the fees and everything is pretty reasonable, pretty low, and all of us have been through the same journey, so we get it. Okay. Uh, Thank you so much. I hope this was helpful. I'm going to stop sharing my screen so I can see the chat box and we can take questions.
Hello,
Hi.
Vrunda. Yes, there are some questions which are being asked by the attendees, and many of those questions have already been answered by Mr. Derek. So there was first question that was asked, that was from the question was just give me a minute. Okay, yes, a question was, OPT after graduation do need to clear NPTE. So this was the question asked by Dr. Digna Rana, and in response to her question, Mr. Derek answered, okay, hello Digna, apologies for the delay. I had some connection problems. So the answer is, it is always required to take the NPTE, whether you want to practice or work in the United States, regardless of visa status, and you are able to take the NPTE on many different visas. Fine. So NPT, it becomes mandatory whether you are BPT, MPT, or PhD. If you want to work in the United States, you have to appear and get through this NPT exam. Am I right?
Yes, you are absolutely right. So there are different visa, like Derek correctly mentioned, there are different visa options. You can be on a student visa, which is F1. You can do H1, you can apply for an H1B visa, which is your work visa. You could be on OPT. There are some people who are married to US citizens, and that is your H4 visa. Or you could yourself be a US citizen, or you could have a green card. Irrespective of your visa status, if you want to work in the US as a physiotherapist, you have to take the license exam.
Okay. There was this second question which was asked by Mr. Smith Patel, that is TDPT or masters necessary for licensing?
No.
And
Good question. So TDPT or masters is not necessary for licensing. So let me go ahead and share my screen again. 1 second. Oops. Give me 1 second. Remember we spoke about so if you are not pursuing a TDPT or masters, you actually start directly from here, which is starting with your credential evaluation and selecting a state. But remember, if you've not done your TDPT or masters, getting a visa is going to be very difficult unless you are a citizen or you are a green card holder or you're married to a citizen or you're married to an H1B holder, H1B visa holder. It's going to be a little difficult to get your visa. That's the first cap. Not that you can't get it, you can absolutely get it. It might just be a little bit tricky. Okay, first thing. Secondly, when we talk about this credential evaluation, which is very specific for licensure, if you have not done your TDPT or your masters, you will have to you will probably have a lot more educational deficits, which if you have done TDPT or masters, you'll have fewer deficits. And also, let me correct myself and be a little bit more specific. TDPT or masters is not TDPT or masters is not compulsory only if you already have a citizenship or a green card. Okay, if you don't have a citizenship or a green card, yes, you do need a TDPT or masters. Just that it doesn't have to be from US. Your masters from India is also okay, but you should have the master's degree. So yes and no. It depends on your visa status whether you need TDPT or masters. If you're not a citizen or you're not a green card holder, you will definitely need to have a TDPT or masters. Your bachelor's degree is not enough, and you could pursue your masters in the US or in India, but you need it. I hope that answers your question.
and there is one question from Ms. Megha Sakaria. What are the universities or colleges that do not have any deficits in their MPT programs? I just want to know, Megha, if you can unmute yourself, is this are you talking about universities, colleges of India, or you want to know about these organizations in USA?
USA, of course.
Okay, make a good question. Unfortunately, the answer is no. There is no such school in India that's going to give you. Well, actually, in India, it doesn't even matter because you've already enrolled with one school. But no, there is I haven't come across a single school that covers 100% of the deficits. Unless you're applying for New York, then yes, most of the schools in India do cover the deficits specifically for New York State. But and no program in the US also is going. There's no one particular TDPT program, or there's no one particular PhD program, or there's no one particular um, master's program that's going to fulfill all the deficits. It really depends because the deficits that you have varies depending on where you did your bachelor's from and where your bachelor's from and what is your year of graduation. So there are a lot of moving parts here. So there is no one program that I can say, oh, 100% you're not going to have any deficits. Unfortunately.
Okay, I hope Megha, you got the answer you desired to hear. And there is few more queries. One query is from Vishesh. Okay, and his query is it possible for an Indian student to directly be the part of a residency program or a PhD program? Or initially we need to be part of a TDPT or master's program?
Good question. So, as an Indian student, you can directly apply to a PhD program. Yes. Um, Something I would recommend if you're applying for a PhD program is make sure you've already done some research work because PhD programs are very research oriented. And if you have zero research experience, that's going to be a little challenging to get in. Not that you can't get in, but know that they hold you at a much higher standard when you're applying for a PhD versus when you're applying for other programs. Okay. Talking about the residency, it's a little difficult to directly apply for a residency program because, like I mentioned, residency is one thing for which you have to be licensed already before you can apply. If when you're applying for a on-site TDPT or a master's, it's okay if you're not a licensed physiotherapist in the US. But for residency, you have to be a licensed PT. So all the steps that I mentioned, you will have to go through all those steps. And then once you get licensed, then you'll have to apply. Okay. Also, another thing with residency is even if you directly apply for a residency, they are not going to give you a student visa. So unless you're already a citizen or a green card holder, or if you have done your master's or TDPT and you're on OPT, then you can use that OPT to do a residency. But the residency itself is not going to give you a work visa or something because residency is paid. You get paid when you're doing the residency versus when you're doing master's and TDPT, you're not getting paid. They will sponsor your visa, but for residency it's a little difficult, I would say, and it's extremely competitive. But for PhD you should be able to apply directly provided you have a strong background in research and writing and all of that. I'm going to take Arti's question. Is it, I think it wasn't answered, right, Derek? Yeah. Okay, Arti's question was, is it necessary to pursue PhD for you to pursue an academic job in the US? What's the duration? Also the pay? What are some good university programs applying for PhD? Good question, Arti. Is it necessary for you to pursue? So the answer is yes and no. If you plan to apply to a good school, right? Most of the schools will require require you to have a PhD. Okay, if not a PhD, at least a DPT will be required because when you look at yourself, okay, say for example you graduate in 2021 and you look at another candidate who's a US trained physiotherapist and they have graduated in 2021, they already have a doctorate degree, okay, DPT degree, which is different from PhD, versus you may have a bachelor's or a master's degree and you're a foreign trained PT. So they will always have like their degree is much, much higher than yours, even though none of you have PhD. So at least a DPT would be recommended if you want to pursue an academic job. And if you're applying to the top schools in the US to become a professor or something, PhD is required. Every school has different standards. Like there are some schools that are not really research based, and for them they don't require their professors to have a PhD. But research is huge in the US. So most of the PT schools, especially the big schools, are very research oriented and research focused, and they want you to have a PhD. So just to make sure that you have a better chance of getting that job, I would recommend doing a PhD. It's not a hard and fast rule, but it just puts you in a better position. The duration of PhD, depending on which program you choose, could be anywhere between 4 to 5 years at least. Okay, it can go up to 7 years. The pay differs from state to state, and it differs from whether you've done your postdoctorate or not. What are some good universities program providing PhD? That's a good question. I think I'm going to ask Derek to share the FACTSPT website. We have a lot of information about a lot of different TDPT programs and everything, and I think PhD programs are also included in that list. So you can go through that list and see which program fits your need the best. Some of the good ones that I'm aware of are University of Pittsburgh has a great PhD in rehabilitation sciences. There is, I want to say there's Fresno State, but I'm not sure. Derek can correct me if I'm wrong. But yeah, Derek just shared the link. You can go through that link for TDPT programs, or if you don't find PhD programs on that list, just send me an email and I can send you another link which will have the whole list. But off the top of my head, I know University of Pittsburgh because I've met and interacted with PhD students from University of Pittsburgh, and I know that's a good school. Krishna's question was only MCQ, a theory exam for license, no practical exam. Correct, Krishna. Not even theory, no theory. Only 250 MCQs, no theory, no practicals. Isn't that awesome? Okay. Digna has written, was Digna's question answered? Okay, hold on. Okay. So Digna's question is, hello, I'm currently gaining experience as a clinical head in cardiopulmonary clinic. I was planning for September intake this year, but due to COVID, couldn't make it. So probably in Jan 2022. I have 2 to 3 consultants who keep on pushing me to go for similar kind of courses like exercise training, sports management. So they would not require license exam, that is NPT. They say it's difficult for Indians to crack. So going for other courses are safe, like at least you can work. During or after practicing can do preparation for exam and plan to clear it out. Okay, hold on. Digna, if you want to work in the US as a physiotherapist, it doesn't matter what course you do, it doesn't matter what your visa status is, it doesn't matter if you have 25 years of work experience, you have to take the NPTE. So I'm not sure who the consultants are, and that's not true. If you want to work as a physiotherapist, you have to have your license, you have to have your NPT, you have to take your NPTE, because all the US trained students also take their NPTE. Unless you want to work in a non-clinical environment um, like kind of doing research on the back end or doing masters in public health or something, then, and if you're not going to be interacting with patients, then it's okay to not take your NPTE. Remember, you're not working as a physiotherapist, as a licensed physiotherapy clinician in that case. Okay, then it's okay to not take it. But if your goal is to work with patients like you do right now, you have to take the NPTE. There's no way out for us or even for US trained students. Okay. um Arti, can someone work clinically concurrently while pursuing a PhD? Yes and no. It depends on the school that you're applying to. Some schools do give you that option of working while pursuing your PhD. Some schools do not give you that option. So it really depends. And again, Aarti, coming back to the license, if you want to work clinically while pursuing your PhD, you will have to clear your license exam first. Okay. I'm guessing everybody's questions were answered. Ishita, I did my master's from India. I don't want to do masters again, so I'm planning for license exam. But the thing is, how can I come to the US and give the license exam? Which visa will be a good option? Good question, Ishita. If you don't want to do your masters again, since you already have a masters, first of all, go through. Remember the slide I mentioned. You have to do the evaluation, the professional evaluation, which is for the licensure. Then you will have to make sure that your education is equivalent. If it's equivalent, great, you can take your license exam. If it's not equivalent, it doesn't matter that you don't have a master, that you already have a master's, you will still have to take some extra courses, which you can take from India, which is okay, which are these online courses. And let us know if you need help figuring out which courses you want, which courses you need to take. Once you do that and you're eligible for the license exam, what most of the students do is they apply for a tourist visa, because to take the license exam you have to be in the US, or you can even go to Canada and take the exam. But if you want to come to the US to take your license exam, you can come on a tourist visa and take the exam. Now here's the thing, even once you go back to India and say you've cleared your license exam, you still cannot come to the US and work, because now you will need an H1B, because you don't have a US citizenship, you're not married to a US citizen, and you don't have a green card. Considering these things, you still, even if you are licensed in the US, you cannot directly go and work, because though you're a licensed PT in the US, you don't have the work visa, which is your H1B. So you'll have to apply for an H1B, and then you will have to go through that whole process. Which, if you do your TDPT in the US, like coming to the US, and if you do your TDPT, you'll get your OPT for 1 year, depending on which course you do, about 1 to 3 years. And then you don't need an H1B for the first 1 to 3 years, depending on which course you do. And you can go from there. So you can apply for a tourist visa. That's a quick answer to your question. But to elaborate on it further, you cannot work on a tourist visa. Even after getting your license, you will have to apply for an H1B. All right, it looks like we've answered all the questions, Dr. Bhavik.
Yes, Dr. Gupta, but I would like to ask two queries from my side, because
Sure.
we have been coming across a lot of issues, because students, when they are in third year or fourth year, okay, those who are genuinely planning for the abroad, they keen to know these processes. Okay, so one query is, which are the important technical and academic aspects that one must consider while planning for USA. Technical, I mean to say, regarding this visa process and planning for the TOEFL, and academic, I mean to say, as you already told that first you need to clear all the deficits before going for the USA. So technical and educational aspect points, which are the important points that we discussed.
Sure. So one of the first things I would consider is what visa you plan to come on, and this can be different for all of you, right? I'm not sure what everybody's. Some people can already, if you're not a citizen or not a green card holder, you're going to if you're coming to the US, first thing is you're going to be applying for an F1 visa, which is your student visa. Okay. Secondly is make sure you have a good score in your physiotherapy bachelor's program. Most of the schools require, because when you convert your mark sheets, your marks in India into like your transcripts, right? They calculate something known as GPA, and make sure you have a good GPA. Like most schools require you to have, excuse me, anywhere more than 3 to 3.5 out of 4 GPA. So make sure you have a good score over there. Third thing is start preparing for your TOEFL exam. If you can speak basic English really well, I wouldn't stress too much about it. But if you feel like your grasp on English language is not that good, then start preparing in advance for your TOEFL exam. I would also start researching which universities you want to apply to, because for every university you might be required to write a different essay, like or you might be required to get recommendations from more professors or something like that. So start preparing all of those things, like start working on your statement of purpose, start working on your essay, start looking at which schools you want to apply to. Do they need you to take TOEFL? What evaluation they want you to do? Those are some of the things. Talking about the license exam and knowing which courses you're going to be lacking is going to be difficult to say, because this really depends on which school you've graduated from in India. So if you've graduated from Maharashtra, it's going to be different. If you've graduated from a private university in Delhi, is going to be different. It's going to be different for every state, for every student from different states. So that is a little bit difficult to say. But on your end, you can definitely be proactive and start looking at schools, start looking at what your long term goals are. Do you want to be a researcher? Do you want to be a practicing clinician? Do you want to do a specialization? And then accordingly, go ahead and pick your schools, so on and so forth. And start looking at schools and apply to more than one school, so that you are not just so that all your eggs are not in one basket. Like start applying to different programs. Look at another super important thing to know is look at the admission like deadlines, because in India, how like we kind of get admission about 2 to 3 months before the course is going to start. But in US, for example, if the course is starting in August, the admission starts, like say if the course is starting in August of 2021, whether it is your residency or whether it is your master's, the admission cycle actually is going to start in October of 2020, and it will kind of shut anywhere between Jan to Feb. Okay. And by March or April, you will hear back from the school. So the admission process usually starts at least 8 to 10 months in advance. So keep an eye on those deadlines. Otherwise, you will have to drop a year. You'll have to miss a year, and then you'll have to apply the next year. So keep an eye on that. Again, every school has different timelines, but most of the times it's anywhere between at least 6 to 10 months ahead of when the course is going to start. When is the ideal time to prepare for TOEFL and applying a visa to study in the US? TOEFL, again, it depends. Like when I was preparing for my TOEFL, I just studied for 3 weeks and I took the exam. I found out much later about TOEFL, so I actually came here and then I took my exam here. So that's why I mentioned about TOEFL at the very beginning, because that's something I wasn't aware of. But depending on how good you are and how confident you feel about your grasp on the English language, I think anywhere between 1 month to 2 months is a good time. If there are a lot of online options, like there's Noteful, and there are these coaching programs online, or sometimes even there are some coaching programs even in India. So you can kind of check those out and see if you need any coaching for that. TOEFL validity is 2 years. So at the time of licensing, would the expired score result be valid, or is it necessary to reappear for it? Make a good question. Here's the thing. Yes, TOEFL score is valid only for 2 years. However, if you send your TOEFL score to your professional credentialing agency, that score becomes valid for 5 years. Okay. Just I mean, but a lot of times for your visa purposes, they might not accept it. So yes, if your TOEFL score has expired, you will have to take the TOEFL exam again. But 2 years is a good enough time because most of the programs, even if you do a master's, it could be anywhere between 1 to 1.5 years, or your TDPT could be around 1 year or 1.5 year long, or sometimes your master's is 1 year. My master's was just 1 year. So the TOEFL score is valid by the time you take your license exam. So I didn't have to take it again, but sometimes you may have to take it again. So yes.
Okay, the last question that I would ask to you, that what is the right time according to you, okay, to start planning for the USA?
At least 6 months to 1 year in advance. Especially considering COVID, a lot of things have changed, and the timelines have changed too. So I think 6 months to 1 year in advance is a good time. I personally did it within 4 months, but I know how stressful it was for me. So at least keep a buffer of 6 months, and at least start your research, right? Start looking at, okay, what do I want to pursue? Look at some PhD programs. The websites, like all the universities in the US do a great job of maintaining their websites, so they will tell you what the program offers. So go through the websites of the programs that you're interested in, and see if it fits your needs. So kind of start planning ahead, of at least know which schools you're going to apply to, at least be aware of what documents you're going to need to submit. Are you going to be required to take TOEFL? What are the expected scores for that university? Just at least start with your research and then apply from there. If master's program is 1 year, what's the duration of OPT? 1 year.
Okay,
So yeah, anywhere between 6 to 12 months is a good time. Not that you can do it in less than 6 months. It's just going to be too stressful last minute.
so yes, I
So
will just say
plan
that
ahead of.
I would suggest to all those who are trying, if you are going doing BPT and you are in the last year, so as soon as your final year finishes and your internship begins, during that period of time, you must start preparation for the this TOEFL and all. And during this study only, during BPT only, you can start searching for the desired course and the desired universities or the organizations that offer the course of your interest. And
I would
I just want to
absolutely
know,
agree with you, Bhavik.
I just want to know, Dr. Vrunda, that all the universities or the institutions, those who are offering various courses like MPT courses or PhD courses, whether do they charge uh, application fees for each of the universities? Because I know about Germany and Canada. Some of the organizations, they do not. They are offering free applications. They do not charge anything. But in US, what is the scene?
Most of the schools will charge you. They will. I haven't really heard of any school that doesn't charge. And of course, this may have changed a little bit because of COVID, because they're trying to be really supportive. But most of the schools will charge you. And the application fee can be anywhere between $50 to $150. But yes, they will charge you for it. So that is why I said plan it ahead of time. Like if you don't want to do a PhD, don't apply to a PhD program just for the sake of it or just as a backup. Like apply to 2 to 3 programs that really interests you, and then go from there. But yeah, you will be required to pay the application fee.
Yes,
If
that
after
is
bachelor's, if I take experience of 1 year, I'm just reading in Sia's question. If I take work experience of 1 year and then apply for TDPT or master's, is it useful or beneficial in any way? I think personally, as you will become a more competent and confident PT with that 1 year of work experience. So I think personally, I do believe that it is helpful to have work experience before you pursue your higher education, because that once you when you're working as an intern, right, you are guided by a lot of professors and everybody, but it's only when you go out in the field and start working with patients by yourself independently, that's when you realize, okay, I know this, I don't know this. So this is what my education was lacking, and this is what I need to learn. And and then you can go ahead and look for programs that offer that, whether it's in India or US, and then go from there. So personally, I feel like work experience does help, but it's not required. I know in Australia, you have to have at least 1 to 2 years of work experience before applying for a higher degree, but in US, you are not required to have any work experience.
okay. These attendees, they are asking about this experience. That is considering that there may be some help in their credits, because if you want to planning for the Canada, for example, they ask for the credits. So if you have experience or of 1 year, 2 year, or more than that, then it will give you a good number of credits. But I think for USA, it won't be counted, right?
So it can, even those credits can be counted. Yes, if you've worked in a particular facility for more than 6 months, those will be like when you're doing your professional evaluation, those credits can be counted towards your clinical education credits. Um, yeah, but it's not a hard and fast rule. If you don't do it and if you're lacking those credits, then you can apply to a school in the US and fulfill those credits, which will be more expensive. But yeah, it's not a hard and fast rule. Uh, you're welcome, Insania, and everybody who attended today. It was a pleasure talking to all of you. If you do have any questions, I'm sharing. Oh, Derek just did it. I was going to say I'm just sharing the email ID, and you can send us an email, and we'll be more than happy to answer any follow up questions. And oh yeah, thanks for the reminder, Derek. We do actually, so Facts for PT, a nonprofit organization, is hosting a free webinar next. No, is it? Oh, so tomorrow we are hosting a free webinar for students who are interested in applying to Canada. So you can go to the website and register for that. And actually, that also reminds me, in next weekend we are hosting another free webinar for, and we are inviting actually. TDPT programs in the US. Like, so we're inviting representatives from different TDPT programs in the US to talk about their program. So if you're really interested in it, you can go to our FACTSPT website and you can register for the webinar and you can attend that webinar for free of cost. And if you have any questions about a specific program, you can talk to the representative of that program and clear your doubts. So I think that'll be really beneficial to all of you who are interested. Thank you for the link and thank you for the reminder, Derek.
I just request Dr. Vrunda, if possible, you share important links or websites or email ID to me in person so that I can share with the attendees, because I have created a broadcast list for them. With a single touch, I can circulate those important links with them.
Definitely, I'd be happy to do that.
Okay, so there are no more queries left. Okay, so thanks a lot, Dr. Vrunda and Mr. Derek, uh, for your excellent session uh, based on this US licensing process, education, and career opportunities in the USA. I hope attendees will definitely get benefit from this particular things that were discussed by Dr. Vrunda. Thanks a lot, Dr. Vrunda, on behalf of Srimad Rajchandra College of Physiotherapy, and I would also like to thank to all the attendees for sparing their time and trying to get the knowledge about the planning for the USA. Thanks a lot, everyone.
Thank you so much, Dr. Bhavik. Thank you, Derek, for joining us today. And thank you to all the attendees for spending a Saturday evening with us and asking your doubts and getting everything clarified. I look forward to seeing you in person one day, and stay safe.
Actually, we would be more thankful to Dr. Vrunda, because in USA and abroad countries, they have hardly off on Saturday, Sundays as well. So sharing your time on Saturday, it becomes very important for us from your busy schedule. So we are
True.
very much thankful to you, Dr. Vrunda.
You're most welcome. Thank you.
Okay, thanks a lot, everybody. Stay safe, take care, have a nice evening, and have a nice day from those who are from USA. Thanks a lot, everyone. And here we are ending today's webinar.